Dr. Sudha has come.
Okay.
She told me.
Why don't you start and then I'll take over. I'll follow. You take it because you're the convener. So
Okay.
you can start.
Yeah. Good evening, everybody. I am Rajvi Mehta and welcome you all to this special interest group of the Indian Fertility Society. This group is primarily focusing on holistic medicine, which I feel is a very unique aspect about the Indian Fertility Society. The other major medical societies do have special interest groups on integrated medicine, but as far as I know, this is one of the rare societies talking of holistic medicine as treating the human being as a whole, rather than treating a system or the symptoms. So before we start this special event, I will hand over to Dr. Neena Malhotra, who will be just introducing this Indian Fertility Society to all of us. Over to you, ma'am.
Thank you, Rajvi. It's indeed a pleasure to be speaking and talking about my society at this forum of the Special Interest Group meeting, a webinar on holistic medicine. And as Rajvi has clearly pointed, as we evolve in our sort of day-to-day problems, I think it's a holistic attitude which is very important. So when it's there holistic, why not for health? And I think when we talk of IVF and ART, we just look individuals as diseases and diagnosis. I think we should give them a complete holistic, part of treatment. And for this, I think this SIG is doing a wonderful job. So I think I'll take this privilege to just speak a few words about my society. Thank you, Raji, for letting me do this. And I will just share my slides here.
Good evening to all of you. Neena, please carry on.
Yeah, thank you, ma'am. I think I have the pleasure to have with us Dr. Sudha Prasad, who's the president. Madam, please, I will be happy if you could give a few words of wisdom to this brilliant.
It's all right. I'm so happy that right in time I joined little late. So it's good. You please carry on. Please carry on.
Yeah, so just for some of the viewers who would have seen these slides of mine, I do it repeatedly at every SIG that we have. I just wanted to say what's so important about our society. We are a leading society of reproductive medicine in the country with nearly 3,000 members. And of course, if we look, we have doctors, clinicians, embryologists, andrologists, even counselors. And I'm sure we have a lot of people from holistic medicine also who have joined us now, part of the counselor group. And what we do is we have a society which is spanning across the country with 27 chapters, right from Kashmir to down south in Puducherry. And now we have moved to 5 zones because 27 chapters have been clubbed together into 5 zones with a chapter in Nepal. And that's how we have kind of divided ourselves. Very peculiar and niche areas of our society, unlike most societies or bodies are, we are focusing on education, research, and publication. We have a very prolific education wing where we have a joint fellowship with the Amity University. A research wing, we have our own ethical committee, and those who become members have the privilege to join us and carry on their research with a due ethical, commitment coming from us. And we publish our journal called the Fertility Science and Research. We have this fellowship program in clinical ART and embryology. And we are happy to share that the clinical counseling in ART is coming. I'm sure Raju will be very excited when this takes over, which will actually involve another aspect of holistic medicine. This is the journal for which we would invite articles and original research and case series. And I think we're really looking forward from articles coming on holistic medicine as well, because this is something which can come only from our part of the world. As I said, that we are known for our research. We have therefore created special interest groups, and you can see that the holistic medicine is one of the earliest of the groups. However, we have added 2 more, including environment and fertility and early pregnancy, besides the routine ones which are there from andrology to ultrasound. I know we've been doing all this, but with the pandemic happening, we haven't stopped doing conferences and seminars. Now we are doing webinars, and the essence remains essentially the same. So this SIG is going to do a workshop on menstrual pain in holistic medicine. We bring about a lot of activities, like we have the Vibrate, which we hold every week. We are talking on the subject matter. Then this is some of the glimpses of the webinars, and I'm sure next week we'll be putting up the glimpses of this webinar, which will be seen showcased in our subsequent meetings. We've done a very, very successful international meeting in the month of July. Our collaborations span with our national and international partners. Nationally, we collaborate with Indian Society of Assisted Reproduction, Association of Clinical Embryologists, and Society of Fetal Medicine. Besides international, collaborations with ESHRE, International Society of Federation of Fertility Societies, and the Middle Eastern Fertility Society. These are some of the publications that we come on regular basis on the newsletter. And of course, these are our regular publications which we bring about besides the newsletter, like IFS Conversation, Catalyst, our texts, and the many. So if you become a member, you have the benefits not only to attend these webinars and meetings for which you will be getting regular information, but you have if your interests are into any particular group like the holistic medicine or the other 15 SIGs, you are more than welcome to join. And of course, I would just end up here by inviting all those who are from the fertility and the field of andrology, embryology, and of course, holistic medicine to join us in this academic celebrations as we are holding our 16th annual Fertivision, which is the first virtual global congress of the Indian Fertility Society. We are happy to share that we have over 50 international speakers who go live, and they are the who's who from the field of reproductive medicine. So don't miss this opportunity. And as members and even non-members, you could log on to our website and join us in this academic bonanza. So thank you, Rajvi. Thank you once again for letting me introduce the society. So over to you for
Thank you, Dr. Meena, for introducing. I would now like to invite Dr. Sudha Prasad. She is the president of the society, and she has been very encouraging. Mind you, I work in both the fields. I work in the fields of embryology as well as the field of yoga and holistic medicine, and therefore I do know how much people give respect to holistic medicine. They do respect it, but they're always very skeptical, because I do admit that in the field of yoga, we often try to make a lot of claims without evidence or without any strong physiological support. And when there is no physiology, no logic, no evidence, and we just claim that it has been there, that's why modern medicine often questions. So wearing both the hats, I understand and respect both the sciences. And I really appreciate the IFS and Dr. Sudha Prasad, who has been very encouraging. So ma'am, just a few words of encouragement before we start our program today.
Thank you, Dr. Rajvi, and good evening to all of you for joining this holistic approach webinar, because I know that it is very, what is the importance, and it is very, very close to my heart. I did a study for 3 years, and I have seen the yoga and infertility, and they really improve. And you have taken a very good topic, Rajvi, of the menstrual pain, because I know with the menstrual pain, people, the young girls are having so much of problem, and they can't express, they do not express to the parents even, to the family even. So this will be the right topic to start the holistic webinar with this, and it will give really, I must tell you, the good one and take home message, and they will apply. If it is the easier one you will show, then definitely they will apply for this. So I congratulate once more, and you please carry on. Thank you so much for calling me and giving me time. Due to the technical problem, I couldn't join right in time. So thank you so much. Namaskar.
Thank you, ma'am. So now I will directly go to the topic, and we're going to be talking of holistic medicine for menstrual pain. And my co-speaker is Rujuta Devekar. I thank you, Rujuta, for joining me. For those who do not know her, which would be the rarest of rare, Rujuta is a very, very eminent, recognized nutritionist who really understands food and also people's love for food. She has got more than 8 books. I don't know, because she's always writing, which have sold over 1 million copies in multiple languages. And just last week, she was invited by none other than the Prime Minister of India for a dialogue on how to improve the fitness levels in India. So thank you, Rujuta, for taking time. I appreciate it. And now we'll go to this topic, which often is understood or misunderstood or taken very casually. So directly, if I go ahead, you will find that when we talk about menstrual pain, What is menstrual pain? And I'm going to be primarily talking of what we term as primary dysmenorrhea, where there is no other history or pathology involved, wherein a girl, young girl is especially, complain of abdominal cramps, low back pain, cramps and pain in the legs, sometimes accompanied by nausea, fatigue, and sometimes diarrhea. And I'm sure that in the audience, all the women who are present, I doubt whether there would be even one who can say that they've never experienced this in their life. Now, having said that, and that is possibly one of the reasons that when we opened out the registration to this webinar, we had about 1,400 people who joined in from different parts of the world with different backgrounds. They are all fertility. They have come possibly for their own self. Now, what is the actual prevalence? Is it something we should really bother about? And I just went through the literature coming from different parts of the world. And here is the studies from Netherlands. I have put the references here just to show they're coming from some of the highest rated impact factor journals, whether the American Journal of OBGY, Journal of Pain Research, POLS1. Then if you look at these studies, they're looking at large number of people. 85% of women in Netherlands who were studied complained of dysmenorrhea. Italy, 84% of the women studied. Ketan, can you just mute the rest of the people? Then there were about 84% from Italy out of 403 women studied who complained of dysmenorrhea. And again, in Sweden, they were looking at students, university and college students, 74%, 89%. So these are what people call as the developed nations. I personally do not agree to the terms of developed nations, developing nations, underworld, third world. I do not understand on what basis they have been categorized. Is it industrialization or economic status? But whatever the status be, this clearly shows that the people who suffer are very high. If you look at the other countries, Australia, 92%, Ghana, okay, so-called developing country, 83%, in Turkey, 88%, and in an Australian study, they did a meta-analysis of 38 studies, and from these 38 studies, they studied 21,000 people, and what they found was that 71% of these people from 38 studies experienced menstrual pain. So you can imagine the amount of suffering that is there. Now, what is this? What is the status in India? And there are studies which have been done in India too. And these studies come from various parts of India. They come from the north, they come from the south, they come from central India. And all these studies, mind you, are in the last 5 years. So if you look at rural Tamil Nadu, they had 72% prevalence. Chandigarh, which included rural areas, the city of Chandigarh, as well as slums of Chandigarh, it's about 61%. Puducherry, it's a small study with just 119. And in such kind of studies, it's always better to have a larger group, 45%. And MP study, again, looking at 310 young girls, found 84%. The fact is that dysmenorrhea, pain associated with menstruation is so high and it sees no boundaries. Whichever part of the world you live in, women suffer from this. It does not depend on the socioeconomic status of that individual. One may be a rich person or a poor person from a rich nation, poor nation, it sees nothing. They have also studied the educational background and it doesn't matter. The reason this was put in is because there are some people who believe that if people are having a lower educational status, maybe they are not so, perceptive of pain. They sort of learn how to handle it because they have a difficult life. So in fact, there was a study in China which associated educational status, and they found lower educational status having lower incidence of dysmenorrhea. However, that study would be taken with a pinch of salt because they have looked at rural pregnant women. And therefore, pregnancy and dysmenorrhea, as we know that with subsequent pregnancies, the prevalence of dysmenorrhea is bound to decrease. Now, having said that, when I go to the next, what is this impact of dysmenorrhea? Okay, people have pain and they manage, and millions of women across the world for centuries have continued. So what's the big deal? Well, we find that in different studies, the young girls, adolescent girls miss school or college. 70% of these people who also find that they do attend school but have problems with concentration, their academic performance is affected, they are not able to perform their day-to-day activities. And even in a country like Sweden, 59% refrain from social activities. In ancient India, people said that menstruating women should not be allowed into the kitchen and should rest. well, we can question the whole whatever that was being done. However, maybe we can look at it that maybe they didn't have the energy, and that is the why they were refraining from social activities. I'm not sitting here in judgment of what was being practiced or approval of what would be practiced. I'm bringing down the facts that irrespective of whichever part of the world they come in, women, young girls, adolescent girls suffering from dysmenorrhea affects their academic performance. And if it affects their academic performance, how do we expect them, or wherein their day-to-day activities get affected, social life? So naturally, their outcomes. Imagine it's the day of exams, and then they are having these problems. So what is the support? Interestingly, even in the Australian study, most of the people, girls, do not talk about it to their teachers. They just endure the pain. The higher your education, you just learn to live with it. And even if hardly less than 15% seek medical advice. The reason they possibly don't seek medical advice is that it is not so severe for them to go. But at the same time, possibly they also feel that what are the options do I have? And what is the medical treatment available? Well, there are non-steroidal anti-inflammatory drugs, but then how long? Can this girl or a young woman take it month after month after month? Would there be no side effects? And possibly they take it when possibly there are exams or important presentations to make, or the other alternatives, oral contraceptive pills, and the rarest is surgical intervention when it is too bad or possibly associated with endometriosis. So most of the time, women learn to live with it. We are told that your mothers live with it, your mother's mothers, your grandmothers live with it. So just learn to live with it. And possibly if it is too bad, you can do some kind of traditional medicine. And this is how life goes on. So friends, I introduce my guru, Yogacharya B.K. Iyengar, who said, yoga cures what need not be endured and endure what cannot be cured. So, well, most of the time I would do admit that women endure what cannot be cured, but is there some kind of intervention, and especially when we're talking of holistic medicine, wherein that we may not need to endure it? I do not know whether whether it physiologically makes some changes, but yes, from experience, personal experience, experience teaching, and surveys that I have done across the world of yoga practitioners, I do admit that yoga helps people endure and also cure menstrual pain. When we talk of science, we need evidence or we need physiological mechanisms. But when we talk of ancient science, we are talking of experience which can be transmitted, which is retransmitted. And that is how we have millions of women, specifically, often I find, continue practicing yoga to overcome this. I would like to extend this definition of yoga cures what need not be endured to ancient wisdom may cure what need not be endured. And that is why I had specifically invited Rujuta for this program, because she mainly focuses on a lot of ancient wisdom, because as I understand, food is, even if it is not written down, has been highly experimented over centuries, over generations. And what we have now is a refined version what our ancestors have researched. So I would like to dedicate this entire presentation, this entire program to my guru, Yogacharya B.K. Iyengar, and his daughter, Geeta Ji Iyengar, who have actually revived this subject the world over, because of which many of us have got freedom from pain. So thank you. And now I will just hand over to Rujuta to take over. So Rujuta, thank you very much for joining in. And
well,
there
thank
you
you
are.
very much. Thank you. Thank you. Thank you very much, Rajvi ma'am, for having me as a part of this webinar. Thank you to everyone at the IFS Society for hosting this. And of course, enough gratitude cannot be paid to Guruji B.K. Iyengar for the massive work that he has done, and the way his work continues to uplift all of us out of our daily aches and pains, reminding us that there is much more to life than this constriction of the body. All right, so I'm going to be talking to you about the foods that you can eat to ease out menstrual pain. A lot of you may already be aware that we recently concluded what we called as the EASE PMS study, and we will very soon be sharing the results with everyone, our findings, stuff that we are extremely excited about. But in the meanwhile, what I'm going to be doing is I'm going to be talking to you about traditional foods which help people overcome menstrual pain. Also, to all of my readers of the 12-week fitness project, you just started with raisins and kesar every morning, and you've seen such a big reduction in your menstrual pain. And in fact, the 12-week fitness project was like a pilot study for us to dive into the EASE PMS study. But before I talk about foods, I really just want to talk about how, as women, we respond to pain, how, as women, we specifically respond to menstrual pain. Now, a lot of us, we are living in 2020, and we are absolutely believers of equality, equal opportunities, equal everything as far as genders go, whether it is a man or a woman or the third gender, we want equality for everyone. But if it's going to be 5 painful days for us women, month after month, then as a little girl, you're shooting the idea of equality right in its head, even before it can take roots, even before this young girl can step out and make a life of her own. I feel within Indian kitchens, within Indian food wisdoms, lies small things that one can do on a day-to-day basis, which will help us overcome this menstrual pain. And once we are no longer aching or suffering or enduring pain, it is our best chance at equality. It is our best chance at equal opportunities. It is our best chance of really living a fulfilling life. It pains me when girls want to know, what can they do to postpone their period just before their exams, or what can they do to postpone their period because they need to take a flight, or what can they do to postpone a period to do something else. Well, you don't need to postpone a period, and a period need not be painful. It can be very, very comfortable. And here are the top 5 foods which will help you make it extremely comfortable to a point where you may almost forget to wear a pad. When we did the EASE PMS study, we had about 6,500 people on the survey talking about what kinds of troubles they went through, whether, what kind of dysmenorrhea they went through and stuff like that, of which we had about 1,400 people who we put through the EASE PMS study, which had 3 simple food interventions. The first one was start your day with raisins and kesar. The other one was add a teaspoon of ghee to your meals. The third one was have a banana at about 4 or 6 p.m. in the evening. And what we saw was a dramatic reduction, about 70% reduction in mood swings, in cramps and bloating, in sugar cravings, and in tiredness and fatigue. So my guess, now that Rajvi ma'am has presented data from across the globe, where we get to see women from different socio-economic strata going through this pain, one of the reasons why food interventions help with menstrual pain is because they help overcome micronutrient deficiencies, more specifically the subclinical micronutrient deficiencies. Now, what are micronutrient deficiencies? I mean, we are in India a massive population of women who are really, really low on iron levels, iron, folic acid, hemoglobin. We are all really poor on that. It even shows up in our blood work. A whole lot of unexplained infertility is sometimes just put down to really low levels of hemoglobin and folic acid. Everyone is aware that even as prenatal vitamins tend to have these molecules of folic acid and iron and stuff like that. So there is stuff which will show up in your blood work, that those are clear deficiencies. We are a big population of that across the globe. There is a 2 billion population which suffers from micronutrient deficiencies, because of which they go through aches and pains and conditions that they need not suffer from. These are conditions that food can easily help with, but because they are unaddressed, one just continues to suffer them. Menstrual pain is one of them. So one is a straight off deficiency. The subclinical deficiencies are deficiencies which don't quite show up in your blood work. So you may be fine in your ranges of B12, in your ranges of hemoglobin, folic acid, vitamin D, and the likes. But just before your periods, you don't have adequate levels of those to go into a smooth period, and therefore you may be having aches and pains and cramps and all the swelling on the breast, the mood swings, the nausea and stuff like that. So what are these 5 foods then which will help you through these, ensure that you don't have this kind of pain? Now typically the timeline that we have seen for this to work is about 3 months. So it takes about 12 weeks of consistent effort for you to actually overcome aches and pains using time tested food practices. So the first one is starting your day with soaked raisins and kesar. So what you're supposed to do is take 2 different katoris and soak raisins, black raisins, about 4 or 5 of them overnight. And in the other katori, 1 or 2 strands of kesar, and again soak it overnight in water. The next morning when you wake up, after you've freshened up and have a glass of water, you start your day by having those raisins and that kesar. This is probably the most useful intervention as far as period troubles, cramps, and bloating goes. And I suspect that it helps because of the iron levels. It also helps with constipation that a whole lot of women have with during PMS and during the first couple of days of their periods. So there are fiber content in the raisins, the mineral content in the raisins, the iron content in the raisins seems to be helping. What a woman should never do is really be on diets which deprive her of food, and especially which deprive her of food for long hours, which then increases your dependence on chai and coffee and cigarettes, the stimulants, to kind of keep going through the day, because all that it does then is that it increases micronutrient insufficiencies, making it that much more difficult for your body to get into a smooth period. So that's one of the foods that really helps. Now, this is something, the raisins and kesar is something that I recommend all of you start doing at least 10 days before your periods, for all of you who are able to predict when your periods come. For the rest of you, after you've had your period, give it about 20 days and then start having the soaked raisins and kesar every morning. So that's the first intervention. All the other interventions that I'm going to be talking to you about, I mean, surely the second one is about a vegetable, and this is something that you need to be including in your diet at least about 3 to 4 times every week. And the vegetables which you need to include in your diet 3 to 4 times every week belong to the category of roots and tubers. So the suran, the arbi, the rataru, even the potato, the root vegetables really seem to help, which is also why we will be going into Navratri very soon. That during Navratri there was so much emphasis on women having these root vegetables, whether it was people make kache aloo ki ya ratare ki tikki, they would make a halwa out of it. You can simply have a suran bhaji, you can have arbi ki tikki ya bhaji, and these vegetables are rich in fiber, they're rich in polyphenols, they're rich in hormone-like substances which exist naturally, and they really allow you to not just to have a smooth period, but also with better skin and hair, because invariably painful periods also come in with acne, with pimples, with loss of hair and the likes, you know. So these are the vegetables that you need to be having at least 3 to 4 times a week. And oftentimes these are exactly the vegetables that you're asked to not have to lose weight. And in this whole chakkar of losing weight, all that we'll end up having are these raw salads, or now simply the broccoli and the kale and the asparagus. And it's almost like we're just not touching these root vegetables, but it is the root vegetables, these indigenous vegetables, which actually have the power to help you overcome period pain because of their nutrient profile. So cook them using your traditional cuisine, and make sure that you're eating them at least 3 to 4 times every week. The third food that I would recommend all of you to have is something which, again, in the world of dieting, we don't tend to have: a banana in all of its forms. So you can have a whole fruit, a whole nice, fresh, ripe fruit by 4 or 6 p.m. in the evening. And that is something which will help you have a smaller dinner. Then having a smaller dinner helps you sleep better. Sleeping better helps you wake up fresher. And the reason why having something wholesome between 4 and 6, something like a banana, helps is because when you don't eat anything at all at this point of time in the evening, between 4 and 6 in the evening, you have only two options. You either just push your appetite all the way into dinner by just having some, again, stimulant, some chai, coffee, cigarette, or an appetite suppressant, or you simply succumb and do the samosa and the vada pav and the bhel puris of the world. Now, at both these extremes, you're doing a great disservice to the nutrient profile of your body and of your meals, because all that it's going to lead into is you overeating for dinner, you losing your sleep. And the minute you're not sleeping properly, your body is not able to have its hormones in a state of balance. So for your hormones to be in a state of balance, you need to be eating in a state of balance. So that banana by 4 to 6 p.m. in the evening, a small, which allows you to have a smallish dinner, which then allows you to have good sleep, which then allows you to have better hormones, a much better hormonal status, and which then allows you to wake up fresh in the morning in mood for some yoga that Rajvi ma'am will be showing us later, or just to in the mood to get up from the bed without really needing an alarm. Now, banana in all its forms is useful. So you can have it as a fresh fruit. That is something which is accessible. You can have it 12 months a year. Again, rich in fiber, good with potassium, good in vitamin B. So every time you have a bad mood, or if you're just bloated, I say this very often to all of my clients, that if you have a party to go to in the evening and you want your stomach to look flat, eat a banana and go, because it just ensures that you are able to get rid of all of your bloating. I say that to my clients even when they're doing big flights, because flights will also bloat you up. For all working girls who work in air cons all the time, for all the girls who've been doing endless webinars, a banana is extremely helpful. So surely do a fresh banana. But you can also have bananas in other ways. So what are these other ways? A raw banana is extremely good. So a raw banana ka bhaji, raw banana ka patties, raw banana ka chips once in a while as a mid-meal or a snack is useful. You can do the raw banana bhaji as a part of your main meal, your roti, sabzi can be the raw banana. And other than the raw banana, the other part of the banana which you should also use is the banana flour. The banana flour is very, very therapeutic because Again, it helps you strike a better hormonal balance. This is again going into one of those neglected and underutilized species. Most of us don't even know what a banana flower looks like. Probably I'll ask my mother to post a recipe soon about the banana flower, but the banana flower is cooked along with legumes and it's eaten as a sabzi, and it's very, very wholesome by itself. Ensures that you get your B6, your folic acid, your amino acids, your fiber. It's beautiful to taste and allows you to have a smooth period. So make sure that the second point, which is root vegetables, tubers, you're having them. And the third one is banana in all of its forms is really extremely useful for girls who are having bad periods or period troubles, or the ones who kind of know कि चलो 2 दिन तो मेरी छुट्टी होने वाली है. The fourth point here that I'm about to make is of grains. Again, a lot of people kind of seem to go off grains the minute they are on a diet, and somehow a lot of girls with bad periods get the advice of just lose some weight and you're going to be okay. Well, you're not going to be okay because you lost some weight. You're going to be okay because you built some health. So get healthier than what you currently are, and that's how the period pin goes. But to get healthier than what you currently are, you have to eat better than what you currently are. And by eating better, what I'm really saying is that you have to eat more diverse foods than what you're currently eating. If you're just doing like cornflakes for breakfast and some salad for lunch and I don't know, some soup for dinner, if that's what you're doing, then you're not eating a diverse diet. But when you include nuts, when you include raisins, when you include roots and tubers, when you include the banana flour in your diet, then that's when you begin to have a more diverse diet. So the fourth point that I'm about to make here is of ancient grains or of millets. Extremely useful in period trouble simply because they add better diversity to your diet. When there is more diversity to your diet, you actually enhance the diverse gut bacteria profile in your system, and that seems to influence the health of your ovaries and reproductive system. Extremely useful for women with bad periods, also for women who suffer from endometriosis, even the ones who seem to be going through pigmentation because of periods. So what grains am I talking about? Kuttu, for starters. Again, it's going to be Navratri. Kuttu is something that people do eat during Navratri because it's a reminder traditionally to just go back to eating in a more diverse method. Kuttu is also one of the grains that Vyas had, that Vyas Muni had. And Vyas, as you know, is responsible for for Mahabharata in more than many ways. I mean, look at the number of people that he gave birth to. So what we tend to do in our line of work is any time that a woman wants to go through the whole procedure of freezing her eggs and therefore wants to have wants to really optimize on good quality eggs that she can then put into a bank, we get her to eat more kuttu. We get her to eat, like I said, more raisins, more of these underutilized vegetables, more banana flowers, but in the grains, more kuttu. So kuttu, I think in English it's called as buckwheat. Extremely useful grain. Make sure that you're eating it at least once every week, especially in winters. So kuttu is one such grain. The other one is rajgira. We used to traditionally eat a rajgira chikki or a rajgira laddu as a mid-morning meal. Works very well, especially for young girls who are hitting their puberty or who may have had first couple of bad periods. Just get them to eat a rajgira laddu or a chikki every day and watch that period pain disappear, because it's going to load you up on calcium. It's going to load you up on iron, but it's the calcium really which will ensure that you're not really going through these back cramps and stomach cramps during your periods. What else? Of course, the usual bajra, makai, um, jowar and nachni, but the bajra, makai, jowar, nachni as per the season. So bajra in the winters, jowar in the summers, nachni you could eat year round, makai again in the winters. And no multigrain breads, no multigrain attas, no multigrain with 100 seeds on top of it kind of things. Okay, so have them solo and have them like the way you would traditionally have it. During your periods, do not forget to have sabudana khichdi. So just during PMS or your periods, especially for the ones who get so much pain that they lose their appetite, sabudana khichdi, which is cooked along with ghee, along with potatoes, along with the green chili and the jeera, really ensures that that you begin to feel a little easy on your stomach. So these are the grains that you need to be including in your diet. And the fifth thing that one needs to have is, of course, the little seeds that we have now forgotten. Two specific seeds here that I would like to draw your attention to, which have traditionally been used in ensuring that the girl is going through a smooth period, a smooth, pain-free period. Number one, Ariv or garden cress seeds. Extremely high in folic acid, very good levels of iron. You mix them with coconut and jaggery. You can turn it into a laddu, or you can very simply add a pinch of RF seeds to your haldi milk in the night. That will help you with good sleep and good iron levels. RF also very important for people with hair problems, and makes eating an Arif laddu a day will ensure that you have a smooth, pain-free period, because it just makes sure that your hemoglobin levels don't really drop to very, very low. You must remember that every time we have our period, we lose blood. And while the body makes up for its blood volume, for the lost blood volume in just about 48 hours, it takes a lot of time for the body to make up for all of the minerals and the nutrients that it has lost through the blood. And of course, I don't need to say this aloud, but it isn't bad blood that we lose every month. It is very much good, nutritious blood that we lose every month. And we need to make sure that we are providing our body with all of those nutrients again, so that it is very well prepared and ready and equipped for the next smooth period. So the Ariv Laddu is very useful. And the second seed, which is important, is the dhana ka seed, dhania seed. And the way dhania seed is eaten is just about one or two of these dhania seeds placed on a piece of dry coconut. So dry coconut, you put a little bit of jaggery on it, and then one or two dhania seeds. This is also one of the things that is eaten as a celebration in communities of South India when the girl gets her first period. It allows for easier flow, without any kinds of aches and cramps. So do remember to eat these seeds, because again, we are just losing out on this wisdom because we don't quite pay attention to oral wisdom. And we don't want or our traditional wisdom to come to us through hashtags and New York Times articles, like haldi milk. We are waiting for someone to call it the golden milk or turmeric latte before we actually begin to have it on a day-to-day basis. So remember these foods. I'll quickly recap them for you. The raisins, the roots and tubers, banana in all of its forms, the kuttu, the sabudana, the rajgira, and these two seeds, the IF seed and the dhania seed. Along with this, do not forget the very basics of eating correctly, whether it is rice, whether it is coconut, whether it is ghee. All of our traditional things have to be a part of the diet. Ghee, especially, because it has short chain fatty acids. It's one of these essential fats that our body needs. It allows for easier assimilation of vitamin D, which is important for having the thyroid function well. And you all know that thyroid plays a role in your in your periods and how smooth your periods are going to be. Also, ghee will ensure that you have adequate levels of A, E, K, D, all the fat soluble vitamins, vitamins which are typically called for, you know, good skin, good hair, good nails. So with all of these foods, make sure that you're eating at least a teaspoon of ghee with your breakfast, lunch, and dinner, and watch your periods get smooth and pain-free. Because if I had one wish in my life, this is really my wish for every girl, that, you know, right, like through her fertile age from 15 to 50 or whatever the number of years that we have our periods, that we get our period month after month smoothly without any aches or pains, and that we are able to fulfill every aspiration and ambition that we have for ourselves in our life, and that we do not really need to take a back seat because of our gender, because whoever told us that our gender comes with monthly pain probably is just not aware of all the goodness which comes from these undervalued ingredients in our kitchen. So thank you very much, Rajvi ma'am, for this opportunity. It's been wonderful connecting with everyone, and I'm really looking forward to the asanas that you're going to be demonstrating, because we've really used them on all of our clients, and they come back with wonderful feedback about how these asanas that you're going to be showing help them with their periods, how they help them to just have a more normal, fulfilling day-to-day life. So thank you to everyone who's tuned in. And I think over to you, Rajvi ma'am, for the yoga bit on the menstrual pain. And then maybe once you're done with your part, we can do Q&A. Thank you very much.
Thank you, Rujuta.
Thanks.
Thank you for all those tips and all the wisdom and keeping the ancient wisdom alive. Friends, I will be now talking to you, possibly demonstrating a bit about the asanas, which is the third aspect of Ashtanga Yoga, on how it can help these women. Now, most often, whenever we meet people and they say, okay, I am practicing yoga, I will look up yoga on YouTube, I will look up yoga in a book, and can you just tell me what I should do? What is most important for yoga is not just what you do, but how you do it. So it is easy to give a prescription. In medicine, a prescription is given, but the medical doctor is assured that this prescription, they will also ensure that the FDA ensures that the drugs that are provided are of a specific quality. But here, if you're doing asanas and if the quality is compromised, then don't expect effects. Also, I would like to give a warning right at the start. While the popularity of yoga is excellent, very often we tend to take yoga very, very casually. Remember, the sage Patanjali in the Yoga Sutras has said, Satudirgha kala nairantarya satkara sevito dradabhumihi. It is long hours of uninterrupted practice which gives you a firm foundation in yoga. So one cannot expect to learn yoga over a weekend course or a week course, but at the same time, one can at least get introduced to the subject like the webinars like this. So the reason I'm giving this is that it is not just what you do, but how you do it. And therefore, I will request the audience to be very careful about certain of the tips that I would be giving. As Rujuta spoke of those 5 important, I will also give you a few asanas. Now, the first and foremost is what we do is the first asana in our practices is Tadasana. So Tadasana is where you stand straight and tall. And mind you, the posture, the so-called skeletal-muscular posture affects the organs in our body. And very often when a person is in pain, they tend to droop because, so this pelvic area, which is anyway undergoing contractions, is anyway under restrictions, one tends to go further bending down with pain, so creating more problems. So when you stand, the first thing you need to learn to do is stand straight. Now, what I mean by standing straight, you will say I'm standing straight, but my whole spine is dropping down. It is dropping down. It is collapsing. So how do I lift my pelvic region up? So when I stand in Tadasana, I'll raise the foot up widen and broaden the foot, place the mounts of the toes on the floor. And as you can see, when I have done it on this leg, what is the straightness in the legs? My knee doesn't bend and the entire abdominal area gets lifted. Second thing is, same thing I do with the other leg, and then I stand in Tadasana. If you're very fatigued, you can even go closer to the wall. So you are supported by the wall, but ensure that the pelvic area gets moving backwards and upwards. It's a sensation that you get. You do not suck your pelvic area in. You do not suck your lower abdomen in, but you work on the legs. In yoga, we refer to this as the apanic region, which is governed by the legs. So if the legs are dull, ensure the lack of health in the apanic region. So legs strong, thigh muscles going back, sides of the hips automatically go in. And all of us women are very conscious, if our hips start broadening, we want them compacted. So the more you move your thigh muscles back, hips contract, and you will feel a lift in the spine, firmness in the legs, and then you start getting what I would term as an access. The organ exists, but do I feel it, or do I feel it only when there is pain? So once you learn to get that firmness, and mind you, this need not be done only during menstruation. It can be done by one and all, men, women, youngsters, whatever your age. If your standing is not straight, obviously rest of the things get affected. There is one pose which helps tremendously, and that is Baddha Konasana. Now, the uniqueness of Guruji B.K. Iyengar's teaching is that he brought yoga from what was meant for mystics in those times to the common man, to the ordinary person, and he devised the innovative use of things, material that is available at any house. So I'm using a bolster. You could use a couple of blankets. If you don't have this, you can fold 2-3 blankets. You will sit on the bolster and sit in Baddha Konasana where you spread the feet. Now, if you see this posture, my abdominal area is sinking and simultaneously I'm leaning to the front. So if I am to sit straight in Tadasana, you can see my knees are very high. And if I have to sit, my whole abdomen is going back. So if you see from the back, if I'm just sitting casually, my whole lumbar area is dropping. So how do I sit straight? So I will place my hands on the bolster, slightly lean forward. Now, the moment I lean forward, I will raise my buttocks up. So I go to the frontal edges of the buttock bones. So the moment I go onto the frontal edges of the buttock bone, you can see what happened to the lower abdominal region. If I'm just sitting, the body is collapsing. There will be no benefit from the asana. You'll only become dull and grumpy. So placing the hands, lift up and then sit straight the moment you get that lift. Now, if you are flexible, you can slide to the frontal edge of the bolster and then gently slide down and sit. When you are in pain, you can sit in this position as long as you want. Initially, give yourself 3 to 4 minutes. Even if there is pain, anyway there is pain. So with that pain, sit, and then gradually the pain starts diminishing. So you keep sitting it. There may be some of the seniors who will say, I have a knee problem, but mind you, this problem is much more prominent in young girls. So you can sit like this. And then keep ensuring. Gita ji has always said that the abdominal organs have to move back. We don't want the abdominal organs to be bulging to the front. They move back and they get lifted up. Now, to get this pose still better, you can also start with what we term as Upavishta Konasana. Now, in this asana, again, you will sit on the frontal edges of the buttock bones. So we have the buttock bones, and most of us, even when we are sitting, if we sit cross legs, we tend to sit in such a manner that the spine drops. So I say, lift yourself up, bend to the front, and sit on the frontal edges of the buttock bone, and you'll see your spine lifting up. So even girls, when you are studying, if you have always heard, I have heard it, and I'm sure all of you have heard, sit straight and study. So why should we be sitting straight? So you go on the frontal leg, spine is alert. Remember, the brain sits on an alert spine. So if you want alertness, you want your brain to absorb whatever you're studying, it's important to sit straight. Then you will spread your legs into Upavishta Konasana, walk forward, slightly drag yourself, and then it is important to let the knees descend down. This also works for the older people who complain of knee problem. You can extend the legs. Now what you need to do is, if my legs are bent, abdomen shrinks. I said right in the beginning, this is the apanic region, which is governed by the legs. Now, how do I make my legs alert and active? So you can see, I extend my right leg, I keep on extending my left, extend the calf muscle towards the heel, and I can see how this leg descends down. But this is still dull. It is dropping. So I elongate the heel, I elongate the calf muscle to the heel, and then I sit in this position. You can sit in this position for as long as you want. Even if you are having a knee pain, it will give you relief from knee pain, and sit for a while. You can breathe normally. You can take a book and read if you want. So till the abdomen settles. And after Upavishta Konasana, if you once again do a Baddha Konasana, it will come still better. So wherein you can bring your heels closer to the abdomen. Now here, you can use your hands as a support, hold the base of the shin, and lift yourself up further. So the moment the spine elongates, abdomen recedes, and you will feel an expansion in the abdominal region, which gives a lot of relief to the women. And this is something which many girls spontaneously tend to do. But now when done with awareness, it brings a different effect. Now, after this, once you have some kind of a composure, you can work still further, and you do what is called as Ardha Chandrasana. Now, classically, the pose is done where you spread the legs out, only turn the foot of the right, and only completely turn the leg of the left. You will bend your knees, place the hand in front, and then lift yourself up to go into Ardha Chandrasana. Now, obviously, you cannot do this during menstruation because one may tend to grip the abdomen, and the entire focus is on balance. So Guruji has taught that we can use household material. So you can use a stool or a windowsill or a chair. And what you will do is, and the other option you can use is a block for your hands, or a utensil can be turned upside down. Place the hand and lift the leg up. You are forming a right angle between the two legs. Press and then go against the wall and turn the abdomen from the left to the right, from the standing leg to the extended leg. Keep on turning. This gives tremendous relief again from menstrual pain. You can stay again for 10-20 seconds, but since you are fully supported at the leg, at the hand, at the back, you can stay even longer. You need to do this on both the sides. However, because of time constraints, I was not planning on showing you, but maybe this will give you a better clue. So how do you do it? Remember, don't take the leg up first. You will get a catch. So you will spread the legs, turn the leg out, place the block a little away, then lift, and then place it on that stool, and then revolve the abdomen. Your top hand can be on the waist, back is supported, and you stay in what we call Ardha Chandrasana. To come down, bend the leg, release, and stand back in Tadasana. Now, I'm going to show you only poses where there is less risk of you going wrong. Now, another common problem that people face is anxiety. People tend to say that, there is a lot of anxiety, and add on menstrual pain or periods themselves add on to the anxiety. What do we do for that? So I'm going to position two chairs, and you could also imagine as if it's a bed. Now, what do I mean when I say that? I have placed these two chairs. Imagine this is a bed. So you are sitting on this bed in such a manner. So you will sit inside the chair or sit on the bed. So the bed will not have any backrest. Hold, lift yourself up. Keep this bolster, or you can take 4 to 5 blankets or hard pillows, place them on the spine, and then slowly lean back and rest. You will extend the feet against a support. Now, if you were to watch, when my legs are bent, what is the behavior of the abdomen. However, when I extend my legs, you will find that the abdominal viscera descends and that gives relief. To add on, supposing you have a very bad neck, you can even support with a pillow or a blanket underneath the head. Stay there. Youngsters, before exams, this is the quickest way to get rid of anxiety. The chest gets opened. Remember, chest opening to come up. You will bend your legs, hold, and then come up. Remember, anxiety is a common problem because if you're not up to your optimal, then you start getting worried of what the outcome would be. And whenever a person is anxious or a person is under stress, what is the posture? A person under stress, thinking more on the frontal brain, tends to lean like this. A person who is depressed tends to sink their chest. So these postures automatically help you to open out the chest, and you are staying there comfortably 10 minutes, 12 minutes, as much as you want. And you will get up, recovering, and feeling very fresh. So I've shown you so far Baddha Konasana, Upavishta Konasana, Ardha Chandrasana, and now Purvottanasana. Now I'm going to show you few more asanas, especially for people who complain of leg pain. It is called Virasana. So first is what is called as Vajrasana, where you sit on your feet. So you will be sitting on your feet, and if the pain is unbearable, then you can put a bolster between the calf and the thigh and sit on it. The body weight goes onto the bolster presses against the calf and gives relief to the legs from the cramps that occur in there. Also, after you have got, if the pain is too much in the thigh, you can sit, move the calf muscles out, and sit with the hips on the floor. If you are stiff, because these days many people also do, youngsters also often sometimes do not sit on the floor, you can raise your buttock up onto a support and sit. But most of you, if you can directly sit on this, and then you can take the support again of that same bolster. So bolster can become your friend. Place it supporting the spine, slightly move it forward, exhale one by one, place the elbow and rest back. Now again, chest opens. It is very restful for the thighs. In the first few seconds, if you are not a regular practitioner, you may feel a little strain on the thighs. But mind you, if you use your willpower to overcome that strain, that pain disappears. And once you are sitting like this, you will find that the chest opens and you get a lot of relief. And also it helps you overcome fatigue. Tiredness, as we saw from some of those reports earlier, tiredness is a very common problem. Here, it helps you recover. Some of you may complain that your ankles are stiff. If that is the case, your mind will go to the ankle. Then what you could do is you take your mat. Again, a yoga mat is not absolutely essential. Mind you, people believe that if you don't have the yoga mat, you cannot do yoga. Well, the yoga mat was introduced by Guruji only for the Western students, where they often had wooden floors and it was difficult for them, they would slip. It was not essential in India. But however, you can take any other blanket, support the ankle so that you do not feel strained in the ankles if the ankles don't have flexibility. Otherwise, you can directly do it. Another pose which is extremely beneficial to women is what is called a Supta Baddha Konasana. So I showed you Baddha Konasana. In Baddha Konasana, if you see from the side, you will sit and lift the spine. This is not allowed in an Iyengar yoga class where the abdomen sinks, drops. You need to be lifted up. And then in this condition, you will take the hands one by one, move the hips closer and go. To intensify the action, you can hold the ankles with your hands, and then you can allow your shoulders to roll and you can lie down. So this is Supta Baddha Konasana. I will show you two more poses. One is called a Supta Padangushtasana. It is in this asana that again you get relief in the lower abdominal pelvic area. We use a belt in Iyengar yoga, but however, you can use any belt or a towel which will serve the same purpose. Now, why is this important? Is you will be lying down. When you lie down, roll the shoulders are rolling back, and then extend the legs. Now you will be bending your leg during menstruation. You do not take the leg straight up. You will be taking the leg to the side. So take the leg to the side and allow the heel to descend. So again, you will see that there is a spreading in the lower abdominal area, so which again gives relief. How long to stay? As long as you are comfortable. Never keep the legs bent, legs straight. The straightness is important. Here, if my leg is dull, remember your pelvic area is being tortured if your legs are not straight. Straighten the leg, pelvic area opens. You will bend your knee, come up, and then you can do the same on the other side. You can repeat it 2 to 3 times during those days. So you will lie down. So as you can see, I turn, I move my leg, and I keep extending. Here you can see my leg is dull. The thigh is lifted off the floor. So I extend and then I turn. Again, bend your knee and you come up. So this is Supta Padangushtasana 2. Now, I will also show that during menstruation, often people complain of headaches and fatigue. And there is also literature that shows that these people who have a lot of headache and fatigue, even later on in life, their perception of pain increases. So in this case, what you would do is, you would once again make this bolster your friend. You're sitting in simple cross legs. Place this bolster, make your abdomen go over the bolster, and then extend the head forward. If you are stiff, you can even take that support, any blanket, any pillow, and so that your head is rested and it is not thrown down. So rest, extend the arms, and you can stay there. Remember, there is a fear amongst people that if I have a back pain, I should not be bending forward. Friends, it depends how you bend. Now, if I am bending like this, then my lumbar spine is going to ache. I'm trying to go down, but here there is an elongation of the lumbar. I let the pillow come very close to me. I elongate that lumbar and then I rest my head. Not this. If you do this, be assured your back is going to pain. So it is not about bending forward or not with back pain. It is how you do it. So again, I repeat, elongate the spine, extend the trunk, and then bend. So this becomes Adho Mukha. Adho is downwards. Mukha is face, Swastikasana. In fact, all the other asanas that I showed earlier, like Baddha Konasana, you can do a variation wherein you can extend the trunk forward, even in this pose. You could even extend the legs in Upavishta Konasana, support the abdomen, exhale, and extend the trunk and rest the head. So all this gives relief by extending the spine. Remember, low back pain is another common problem that women face. Now, all these give relief to the abdominal cramps and the fatigue that comes in. There is still one more thing that can be done, is to relieve the back pain. And in this case, what is termed as Bharadwajasana after Sage Bharadwaj, wherein what I will be doing is, I take this pillow to the side. You can use blankets. I'm trying to show you with minimal props. I will sit with one buttock on this pillow, sit straight, lift the trunk. Remember, whatever you do, your spine cannot collapse. A collapsed spine is a collapsed mind. It's a dull mind, and the whole body is going into a constriction. We want expansion. So I lift, exhale, I lift, I will hold the thigh and I will turn so as to release the back. So I will show you from the sides too. So I have sit on the sides. Remember, my feet are towards the left. I turn towards the right. I use the support of my palms on the near the knee, lift the spine and turn. So the back gets released. Don't turn like this. Another mistake we make. We are under the illusion that the turning is shown by the head. So I turn my head, but nothing has happened to my trunk. So it is fake. It is an illusion that I'm turning. What is important is the lift, and then with an exhalation, I turn. Then I get a coiling action in my back. So if you want to see from the back, so now you can see how I have placed my legs. I cross them over. I alert my spine. I lift my spine. I sit straight, abdominal area lifted. Exhale. I place my palm on the outer side, the left hand behind. Again, I lift my spine. I coil it in. I can't turn like this. I lift and I turn. Then I get a coiling action in this lower back area, which gives relief from back pain. And also, if you would notice, since this is a group of doctors and embryologists, all of us work on the microscope in this fashion. You may have the best ergonomic chairs, but we know this is our posture. And that is the reason many of us complain of neck pain and upper back pain. By doing it in this manner, you can get release from the lower back and neck pain. Normal breathing, don't hold your breath. Release, come back to the front. This was Bharadwajasana. All these asanas have to be done on both sides. And then finally, you will take this same bolster and lie down in what we term as Setubandha Sarvangasana. You place the bolster lengthwise. I will sit on this bolster. I lean back, so I rest my back, and then slowly pressing my feet against the wall, I slide down. So again, you can see an expansion here. Shoulders are rested, arms to the side, and I stay there. The support makes it feasible for you to stay, and because you stay, you can get the effect of the asanas. If I do it flirtingly for 5 seconds, 3 seconds, then obviously the effect is not there. So here, again spreading, and it gives relief. To come up, bend the knees, just slide this away, and you can remain there resting on the floor. And then you turn to the side and then sit up. There are asanas are many, but what I have shown you are a few which can be done by all of you at any point of time. None of these are difficult. Remember some basic clues. Chest well opened, shoulders rolling back. Remember, spine lifted, pelvic area well opened. So whatever asana you do, if you can manage to keep these tips in mind, you will benefit from their practice. Apart from that, there are many, many asanas, but in this forum, I just wanted to show you a few which you can do. You can refer to a book, and one book that I would strongly recommend to all women practitioners is Yoga, a Gem for Women by Geeta Iyengar. So that is the book which can be used by women for their regular practice, irrespective of whether you have menstrual pain or not, whether you are in the not in the active reproductive age group, whatever it is, you can refer to that book. So with this, I end my presentation. If there are any questions, I will willingly take. Let me see if there are questions for myself or Rujuta. So Rujuta, you can also come in. And the question is this asana safe to do? Whatever I have shown you today is safe to do during periods. So without hesitation, you can do all these asanas during periods. Are all these asanas and food helpful for irregular periods? Rujuta, would you like to take that? Whatever Food,
Yeah,
is it?
I mean, food, of course, is helpful for irregular periods. It will help you regulate your periods. It will also ensure that you no longer have to go through the aches and pains that typically comes with a period.
For irregular periods, actually, from the reproductive biology point of view, we must realize that it is also our gonadotrophins which play a role. And therefore, the asanas that we do are a lot of inverted asanas, which I will not be showing today. But basically, these are the inverted asanas which we do not during the time of periods. In fact, during the time of periods, you should not do any inverted asanas at all. So I have not shown, I've just shown you a few which can be taken. Yeah, I believe there are questions on YouTube and you can put it on the chat here so we could answer them.
Rajni, I had a question. So these asanas that you showed right now, this
Yeah.
is to be done during periods?
Yes. All these I have shown are not only safe during periods, but helpful during periods.
Okay,
So,
thank you for that.
yeah.
Yeah. And they can be safely done by anyone. Would you recommend that people actually practice these asanas before their periods so that when they do have their periods, it becomes easier for them to kind of get into the rhythm of these asanas? Do you have any tips here for people who are
I
watching you?
would say that asanas are not just a therapy. It is not any complementary or alternative medicine. Yoga has a totally, it is a way of life. It has a totally different purpose for doing it, and each of us purpose varies. So it is not that you do these asanas only during periods, or for that matter, only when there are painful periods. You can do it right through, because the more you practice, you will have a more understanding of your own body, a more control of your own body. And naturally, when you have a better understanding, more control, you have more confidence in doing these asanas, and they'll be more effective. So remember that as Guruji has said, for a yogi, the body is his own or her own laboratory. And remember that as scientists, as clinicians, you know how important practice is. For my embryologist friends, we know how much of a learning curve we have for ICSI and vitrification. We will not allow a new embryologist to do these things because we know. So here too, it is not that you should start practicing when you have it. You can start. Maybe that's a motivation, but after that, it becomes a way of life. Another question that has come in is that how long should we be practicing? Do we give so much time? Well, if you can spend half an hour for doing this, and you have benefits for the next 22 hours where you are not grumpy, dull, pain, I'm sure we would be happy to give this time for this practice. So let me see other questions. I'm approaching my menopause, and these days I feel weakness in my legs. Again, see, there are many things to do, but I would say whatever we have shown today, if you do it, that's a start. Once you start doing that, you will start feeling some relief in the leg area. Okay, Rujuta, for you, does going gluten-free and dairy-free help to reverse endometriosis?
Well, all I know is that people are constantly looking at shortcuts, and we are constantly, it's all about just remove this from your diet and you're going to be completely okay. Now, gluten is something, it comes from wheat, and one must, there is no problem with wheat unless you have a very, very specific condition like a celiac disease where it becomes difficult for you to digest wheat. But in all of other cases, your regular roti, sabzi is fine. What you must, however, remember to do is to not forget to include millets in your diet. So eating roti is not the problem, but never eating kuttu, never eating rajgira, never eating ragi, never eating bajra, never eating jawar, not never eating rice, not having that diversity in your diet is really the problem. Again, as far as dairy goes, support local dairies, support the small milk, dairy milk businesses, because these are involved in sourcing milk ethically. Most of Indian farmers and Indian farming families continue to have cows and buffaloes with them as a part of the farming animals. They need us to support them so that they have enough to eat, really. And as far as milk goes, do know that milk, dahi, and ghee are extremely useful for the human body, which is also why traditionally they are counted as panchamrit, along with honey and sugar, or in other areas along with honey and banana. But these three are pan India panchamrits. Also makhan, the white makhan, extremely useful again because of the Wilson factor in terms of bone and joint health. So no, you don't need to go gluten free or dairy free. You just need to go, you need to go into your diets with common sense, respect what grows locally, eat the produce of the season, and cook it traditionally. That's how you get rid of most conditions and menstrual pain.
Thank you. I second you
Thanks.
totally, Rujuta, that
Right.
we cannot just do things at a short term. Don't look for short term things. It always takes time. Now, which is the best time to do asanas, morning or evening? Well, very often we are governed by our own time schedules. So I would say you can do it either morning or evening. You should, if you're doing it any time of the day, you should not have had lunch for at least 4 hours. So 4 hours after lunch, you can do it. If you've had tea or coffee or something to drink, 1 hour afterwards. So accordingly, you can practice these asanas. If you are doing it in the morning, remember the body is a little stiffer in the morning. If you do it in the evening, the body is less stiff. You will find that you're able to do better. But sometimes people get up grumpy in the morning. Just starting your day with asanas will make the day better. So this is what you do. Lack of sleep means lack of some time to get proper sleep. Then how to feel rejuvenated by doing some asanas, shavasana or yoga nidra you suggest. Well, actually, you know what I showed in the morning, the start, the Supta Baddha Konasana, Supta Virasana, Setu Bandha Sarvangasana, the last one which I showed with the bolsters. All these I would call as rejuvenating asanas. So basically, one can divide one's own state of mind into a negative state where we are very, very dull, we are very fatigued mentally, physically, and we would say we are not even at a neutral state, we are at a lower state, lower than neutral state. And when that happens, we need to recover. So we get from a negative to a neutral state. Now, if I were to go into it a little deeper, when you do your Supta Baddha Konasana, your exhalations become longer and these help you to recover. So you come from a lower state, negative state to a neutral state. After that, when you can do your Purvattanasana, the one which I showed with 2 chairs, Supta Virasana and Setubandha Sarvangasana, they rejuvenate you. So you go from a negative to a neutral to a positive state or a rejuvenated state. So all these help you rejuvenate. All you need to do is try it, because unless it's an experiential subject, so unless you do it, you will not be able to get it. Then I have a question, which yoga book should every woman should have? I'm just typing it down. It's Yoga, a Gem for Women by Geeta Iyengar. It's an Indian book and it is available online. The publisher is Allied Publisher. So you can buy it from online or from Allied. Backache at menopause, any specific asanas? Well, what I've shown you, I would say, is like a tip of the iceberg or a flavor. Like you go to an ice cream parlor and then they give you little flavor. So it's difficult to talk about the entire gamut or if what all asanas can be done. However, this, whatever I've shown, can be done by anybody. For the back problem, the Bharadwaj asana I showed would be helpful. In addition, I would say that sometimes people are not able to sit on the floor. Well, you can sit on a chair. This is a yoga chair, but you can sit on any sturdy chair, sit sideways, lift the spine. Remember, this lifting the spine is the most important part. Lift, exhale, and turn. You can place the side which you are turning, the opposite hand. So if I'm turning towards my right, my left hand is on the backrest of the chair, and I turn, this helps relieve the back. So if you were to see from the back, when I'm turning, when I'm sitting, now here, the back is not going to be affected. But here, when I lift and I turn, I can get relief in my back. Okay, so this can be done for your backache. Again, this can be done at any point of time, but not after food. Then
There
backache,
was
yeah,
one more, that I just saw in the chat, that if
yeah.
anyone has BP because of being perimenopausal, then do you have any specific asana advice for them?
Well, whatever I have shown today is safe for anybody with hypertension. Only thing, be careful that you don't hold your breath. You will breathe normally, or where I specifically said you exhale, you will be safe. So don't worry about hypertension for any of these asanas. They will in fact help you in your asanas, including Purvottanasana. There's something on chocolate.
Yeah.
Chocolate, yeah.
Well,
Yours?
I think chocolate is one of those things, which has just been glamorized as a de-stressor, but we are constantly looking at wine for the heart and chocolate for the stress. Actually, you could just have a Rajgira laddu and be much more de-stressed and not have any bad girl complex later, or go on a guilt trip later. There was also another question about raisins and how often can you have them. Well, you can have them throughout the month, but you surely need to have them at least 10 days before your periods to get rid of all of the bloating and the swelling at the breast, also the aches and pains and the mood swings and constipation. So at least 10 days before your periods, you surely need to have it. For the rest of the month, you could have soaked almonds, you can have a fresh fruit, or you could start your day with the banana. But I'm absolutely okay even if you started the entire month, with raisins. Also, there was a question about what can I do about the baggy eyes under my, under the eyes, the swelling under the eyes. Well, we've seen that raisins work equally well even in that case, but it needs to be a wholesome diet. So don't forget to include all of the diverse foods that I just spoke about. Make yoga a part of your life, like the way Rajvi ma'am has been talking to you about, because that's how you improve the health of your spine, and that's how you ensure that there's optimum blood circulation, and then you're not really looking swollen on your face or having bags under your eyes just because you have your period. So it's really about committing to a lifestyle change, really.
There is also this question, are all these foods and asanas uh, helpful for irregular periods? Well, I would actually say that irregular periods often is one of the symptoms of polycystic ovarian disease. And in this case, possibly the entire approach, these can be done. But I would not want to say that this will help you solve this problem. So whatever, these can be done by men, women, everybody. But again, irregular periods or excessive flow, again, one will need to know what is the cause of that. So I would not like to make this very simplistic and say, okay, you have excessive blood flow, go ahead and do it. Yes, you need to get diagnosed for the same, get whatever the reason for that. But simultaneously, this and the food that she's prescribed would help. But also do not try to take this as an alternative to medical therapy or medical advice. Definitely find a proper diagnosis and then you can move towards these practices. Tubers, banana, millets, first two we missed. Well, actually, this entire is being live streamed on YouTube also. So you can refer to it at any point of time. The link was also sent to you. So you can go to the YouTube channel. Somebody has asked for our phone numbers. Well, we are there on Facebook and Instagram. So you can approach us through social media at any point of time. You can also connect with Iyengar Yogashray and you can connect. Just narrate, dear Rujutaji, all foods you have advised on. More time, please. Advised. Well, I'm sure that, Rujuta, I speak for you. I'm sure on this
Yes, please.
topic, we can go on and on and on speaking. So I think that's the reason we discussed over what topic we would cover in this webinar. And the reason we specifically went for this is because such a large number of girls and young women are suffering for it, and they really have no solution for it. They cannot be taking painkillers all the time. They cannot go on to OC pills, and that's the specific reason. So wherein most of them take it as a way of life. So we are trying to show that you can modify your way of life, lifestyle, and you don't need to take such a painful situation as a way of life. Any last words, Rujuta? I think we will be ending now. We have crossed the time.
Yes. No, all I would like to say is thank you very much for inviting me to be a part of this very interesting and educational webinar. I have taken down notes on all the asanas that you've shown, and I'm going to be practicing it myself. And thank you to every listener who's tuned in. It's been a pleasure sharing what I know about traditional foods with you. We also you will find a lot of it on in this book, the 12-week fitness project. And like Geeta, like Rajvi also said, Geeta ji's book, Gem for Women, is, I think, a must resource for everyone. And thank you for everyone at the Indian Fertility Society also for co-hosting this along with Yoga Shray. So thank you all and have a very good evening.
And at the end, I would really like to thank, yes, Rujuta, the Indian Fertility Society, to have confidence in having us as a webinar on this topic. I would like to thank the trustees of the Light on Yoga Research Trust for all the support, and my special thanks to Bhavin and Ketan, who have stood by to make sure that this event went glitch-free. We always have our volunteers in Iyengar Yoga ever ready to support us. So thank you, everybody, and hope you have enjoyed it. You've learned something which will help you. Thank you very much.
Thank you.